Hello, my name is Jeff Dover, and along with Dr. Mark Weisinger, we are continuing our video series on the topic of lung cancer. And today's topic is risk factors with regards to lung cancer. So, Doctor, if you will, tell our viewers about the different risk factors, and also, if you will, tell them what a risk factor is before you go through the list.
Okay, thank you, Mr. Dover. A risk factor is something that is seen statistically. When you look at a population of people that acquire any disease, and you find that they have things in common. And so risk factors are very important from a public health viewpoint. And that actually translates ultimately down to how your doctor treats you and how they counsel you to maintain good health. And for you yourself to take care of your life and avoid risk factors, if at all possible, to reduce your chance of getting a disease. Now, in terms of lung cancer has been around for so long, and it's been diagnosed actually since ancient times. Ancient Egyptians have actually been found to have diagnosed this disease, although they did not have anything but radical treatment for it. But the risks of lung cancer have been known for quite a long time, too. Any kind of smoke exposure, most typically tobacco smoke, but soot in general is a specific risk. Exposure to tar is an unusual risk that a lot of people aren't aware of. Tobacco smoke is probably the most common risk factor. Radiation exposure is one that's known, but those of you who've had a number of chest x-rays in your life need not worry, because this has been looked at very, very carefully by physicians and epidemiologists. These are people that look for the cause of disease. And they found that you would need thousands of x-rays in order to obtain lung cancer from an x-ray. The most common, actually, cause of radiation exposure for most people is radon gas, and it comes through their basements in large parts of the United States, and a lot of people aren't aware of that. Other things that can cause it, asbestos, I think I mentioned that, chromium, nickel, arsenic, a lot of unusual metals and minerals can cause this disease. And one particular type of disease that's caused by most of these agents is mesothelioma, which some of you probably heard about or seen things about on TV. One thing that is never really quite understood and you can't protect yourself from is a family history of lung cancer. And if you do have a family history, particularly if it's first-degree relatives, mom and dad, brother, sister, you should allow your physician to know about it and counsel you accordingly as to how to reduce your risk.
Very good. Thank you, Doctor.